Your lungs work every second of every day without asking for attention. From the moment you take your first breath in the morning until you fall asleep at night, they quietly deliver oxygen to every organ in your body. Every heartbeat, every step you take, every conversation you have depends on healthy lungs doing their job. Most people never think about their lungs until breathing becomes difficult. That's because healthy lungs work so efficiently that you barely notice them. But when something begins to go wrong, your body often sends small warning signs long before a serious lung disease is diagnosed. After the age of 60, keeping your lungs healthy becomes even more important. Years of exposure to pollution, cigarette smoke, dust, allergies, respiratory infections, and natural aging can slowly reduce lung function without causing obvious symptoms at first. The dangerous part is that many lung conditions develop gradually. Instead of making you suddenly unable to breathe, they often begin with subtle changes that many older adults simply blame on getting older or being out of shape. Unfortunately, ignoring these early warning signs may allow the problem to become much worse before treatment begins. The good news is that your body usually gives you plenty of clues if you know what to watch for. Recognizing these symptoms early can help you seek medical advice before they become life-threatening. In today's video, we're going to reveal 9 silent warning signs that your lungs may be begging for help. Some of these signs may surprise you because they don't always seem connected to your lungs. The first warning sign is becoming short of breath during activities that never used to bother you. Perhaps climbing one flight of stairs suddenly leaves you breathing heavily. Maybe carrying groceries from the car feels much harder than it did a year ago. Some people even notice they become winded while making the bed, walking through the grocery store, or talking for long periods. Many older adults assume this is simply a normal part of aging. However, healthy aging should not suddenly make everyday activities feel exhausting. When your lungs can't deliver enough oxygen efficiently, even simple daily tasks begin requiring much more effort. If you notice your breathing becoming progressively worse over several weeks or months, it's important to discuss it with your healthcare provider. The second warning sign is a cough that simply won't go away. Most coughs caused by a cold or seasonal illness disappear within a few weeks. But if you've been coughing for more than a month, especially if the cough continues getting worse, your lungs may be trying to tell you something. Some people experience a dry cough. Others produce mucus every day, especially in the morning. Persistent coughing should never be ignored because it may be associated with chronic lung conditions, infections, or other respiratory problems. The third warning sign is wheezing. Wheezing is the high-pitched whistling sound that sometimes occurs while breathing. It usually happens because air is struggling to move through narrowed airways. Some people hear it only after walking. Others notice it while lying in bed at night. Although wheezing can have several causes, repeated episodes deserve medical attention, particularly if they're becoming more frequent. The fourth warning sign is chest tightness or discomfort. Many people immediately think chest discomfort always means a heart problem. However, lung conditions can also create pressure, tightness, or discomfort inside the chest. Some people describe feeling as though they cannot take a deep breath. Others feel heaviness that comes and goes throughout the day. If chest tightness repeatedly occurs with breathing problems, coughing, or physical activity, it should never be ignored. The fifth warning sign is producing excessive mucus. Your lungs naturally produce mucus to trap dust, bacteria, and other harmful particles. However, producing thick mucus every day for weeks or months is different. Yellow, green, brown, or blood-streaked mucus should always be evaluated by a healthcare professional. Persistent mucus production may indicate ongoing inflammation or another lung condition that deserves attention. These first 5 warning signs don't automatically mean you have serious lung disease. However, when several of them appear together or gradually become worse, your lungs may be asking for help long before a medical emergency develops. Let's continue with the 6th silent warning sign that your lungs may be asking for help. This symptom is often ignored because it develops so slowly that many people simply learn to live with it. The 6th warning sign is feeling unusually tired all the time. Many people think fatigue only comes from poor sleep or getting older. However, your lungs play a critical role in supplying oxygen to every cell in your body. When they aren't working efficiently, your muscles, brain, and organs receive less oxygen than they need. As a result, even simple daily activities can leave you feeling completely exhausted. You may notice yourself needing frequent breaks while cleaning the house, walking through a store, or spending time with your grandchildren. If persistent fatigue appears together with breathing problems or a chronic cough, it's important not to ignore it. The seventh warning sign is frequent respiratory infections. Do you seem to catch every cold that goes around? Does every cough turn into bronchitis or linger for several weeks? Healthy lungs are designed to remove germs before they cause serious illness. But when lung function becomes weakened, bacteria and viruses can remain inside the airways much longer, increasing your risk of repeated infections. Some older adults experience pneumonia more than once within a few years. Others develop chest infections several times every winter. If you're getting sick more often than before, your lungs may be signaling that something isn't right. The eighth warning sign is unexplained weight loss. Losing weight without trying might sound like good news to some people, but after age 60, unexpected weight loss should never be ignored. When chronic lung disease develops, your body often works much harder simply to breathe. Breathing itself begins using more energy than normal. Over time, this increased effort can lead to muscle loss and gradual weight reduction, even if your eating habits haven't changed. If you've lost several pounds without changing your diet or exercise routine, it's important to discuss it with your healthcare provider. The ninth and final warning sign is bluish lips or fingertips. This is one of the most serious warning signs your body can give you. Healthy blood carries oxygen throughout your body. When oxygen levels drop too low, the lips, fingernails, or fingertips may begin developing a bluish or grayish color. Some people notice this only during physical activity. Others experience it even while resting. This symptom should never be ignored because it may indicate your body isn't receiving enough oxygen. If you or someone you know develops blue lips, severe shortness of breath, chest pain, or confusion, seek emergency medical care immediately. Now that you've learned all 9 silent warning signs, remember one important fact. Having one of these symptoms does not automatically mean you have a serious lung disease. Many different medical conditions can produce similar symptoms. Only a qualified healthcare professional can determine the true cause through proper examination, imaging, breathing tests, and laboratory evaluations. The purpose of this video isn't to create fear. It's to help you recognize warning signs early enough to seek medical advice before serious complications develop. Fortunately, there are many daily habits that can help support healthier lungs throughout your life. The first habit is staying physically active. Regular walking helps strengthen both your lungs and your heart. Even a simple 30-minute walk most days of the week can improve breathing efficiency, circulation, and overall endurance. If walking feels difficult, begin slowly and gradually increase your activity level with your doctor's guidance. The second habit is avoiding cigarette smoke completely. If you smoke, quitting is one of the most powerful decisions you can make for your lungs. Even if you've smoked for many years, quitting can still improve lung function and reduce your risk of future respiratory disease. It's equally important to avoid secondhand smoke whenever possible. The third habit is practicing deep breathing exercises. Slow, controlled breathing helps expand your lungs, improve oxygen exchange, and strengthen the muscles involved in breathing. Just 5 to 10 minutes of deep breathing each day may help improve lung capacity over time. The fourth habit is staying up to date with recommended vaccinations. Vaccines against influenza and pneumonia may help reduce your risk of serious respiratory infections, especially after age 60. Preventing infections is often much easier than treating them. The fifth habit is maintaining good indoor air quality. Keep your home well ventilated whenever possible. Reduce exposure to dust, mold, strong chemical fumes, and other airborne irritants that can place unnecessary stress on your lungs. If you live in an area with poor outdoor air quality, consider limiting outdoor activity during high-pollution days. The sixth habit is eating foods that support lung health. Fresh fruits, colorful vegetables, whole grains, nuts, beans, and fish provide antioxidants and nutrients that help reduce inflammation throughout the body. Drinking enough water also helps keep mucus thinner, making it easier for your lungs to clear unwanted particles. Regular medical checkups remain one of the most important steps you can take. Simple breathing tests and routine examinations can often identify lung problems before symptoms become severe. Many people wait until they're struggling to breathe before seeking help. By then, valuable treatment opportunities may already have been missed. Your lungs have delivered millions of breaths since the day you were born. They've supplied oxygen during every family celebration, every walk, every laugh, and every unforgettable memory. Taking care of them today is one of the greatest investments you can make in your future health. Remember, healthy aging doesn't happen by accident. It happens through small, consistent choices made every single day. Listening to your body's early warning signs, staying active, eating well, protecting your lungs from harmful exposures, and seeking medical advice when something doesn't feel right can help you breathe easier and live a healthier, more active life. Starting today, don't ignore what your lungs may be trying to tell you. Those quiet warning signs could be your opportunity to protect your breathing, preserve your independence, and continue enjoying life with the people who matter most for many years to come.